This is the VOA Special English Health Report. Cardiovascular disease is the world's leading cause of death. It includes heart attack, stroke, and high blood pressure. Over the years, researchers have identified several substances in the blood that can serve as what they call cardiac biomarkers. These are used to measure the presence and development of cardiovascular disease. Researchers have increasingly tried to use these biomarkers to identify people who are at high risk of developing heart disease. But a new study has found that they offer little help in this way. A team from Massachusetts General Hospital and Sweden's Lund University studied how effective the biomarkers are as predictors. Thomas Wang at the Mass General Heart Center was the senior author of the study. Dr. Wang said that even after measuring those additional biomarkers, they were not able to fully understand who was more likely to develop heart disease. Dr. Wang says they did identify some combinations of biomarkers that improved predictions of heart attacks and strokes. He said it is possible that in certain patients, measuring these biomarkers would be helpful. But for the majority of patients, having the information of the biomarker probably would not make a difference. Dr. Wang hopes future research will discover biomarkers that are better able to predict the risk of cardiovascular disease. But for now, he says, doctors should depend on traditional risk factors. These include a history of high blood pressure, high cholesterol, tobacco use, diabetes, obesity, physical inactivity, or poor nutrition. A separate study found no support for a theory that a biomarker called C-reactive protein causes heart disease. Earlier research suggested that the more of the protein in people's blood, the more likely they are to develop heart disease. The new study confirmed a link, but did not find evidence that the C-reactive protein causes the disease. Both studies appeared in the Journal of the American Medical Association. The World Health Organization estimates that cardiovascular disease killed 17.5 million people in 2005. That was 30% of all deaths. 8 out of 10 deaths were in low and middle income countries. At current growth rates, the WHO expects the number to reach 20 million by 2015. And that's the VOA Special English Health Report.